A mummy makeover is an operation that tries to give back women their body that they had before pregnancy. Essentially, it's split to three different types of operations. One of them is to do with the breast, so either a breast uplift, breast augmentation, or breast uplift in combination with putting an implant. The other part of the surgery is an abdominoplasty. That's where to remove the excess part of the skin that may have developed after the pregnancy. And this can be done in combination with liposuction and tightening the muscles of the abdomen. And sometimes some ladies also want to have rejuvenation of the labia, and so that kind of operation would be labiaplasty or vaginoplasty in order to just kind of rejuvenate the labia and the vagina. So essentially, overall, it's an operation that, using a combination of techniques, is used to reconstruct the changes after the pregnancy to give back the body that the patients have so changed after the pregnancy. It's a big undertaking. Operations are carried out under general anesthesia and roughly take about 3 to 4 to 5 hours to perform, depending on how many procedures are done. And the recovery time usually can take around 1 to 2 weeks. Most patients are ready to go back to work after 2 weeks having had the surgery performed. So overall, it has a very high satisfaction procedure, and patients do feel that they've made the right choice for this surgery. That's a very good question, actually, and often I'm asked this in the clinic. When is the right time? What's the best age? And to be honest, there is actually no right age to have this surgery done. Obviously, at the plastic surgery group, we don't operate on patients who are under the age of 18 for obvious reasons, because they're not an adult yet and they may not be able to understand and comprehend the complexities of the surgery. But in my books and in my practice, there is no difference between somebody, for example, who's 28 and has had 4 children and is in need of the operation to reverse the changes, or somebody who's 40 or 45 and has had 1 child and again has undergone the same changes. So in my practice, there is no age that's good for this surgery. If you've had your children and the family is completed and the changes require correcting and reconstructing, then I think that's the right time to have this surgery done. So there is really no age that's good for this operation. Most patients are in the range of from their mid-20s to mid-40s, and that's probably the majority of my practice, but it's never too late to have this operation, even when you're in your 50s and 60s, as long as there are no medical problems that need to be addressed before the surgery. So I think it's a mistake to think of this as a procedure that's age-specific, as long as the changes are compatible with what happened when need reconstruction. So that's the right time to have the operation done. It's a personal choice. So in my practice, I always tell my patients that the best time to have this operation is when the family is completed. So if you're planning to have 1, 2, or 5 children, the best time to have this is when the family is completed and you're not going to have any more children. Because once the operation is performed, like the breast uplift or the abdominoplasty or the labiaplasty, all of these can change once again after the pregnancy of a 2nd or 3rd or 4th child. So most patients would prefer, and certainly in my practice, I would prefer to wait until the family is completed. Having said that, however, I have many, many patients who come and see me, and having had their first child, the changes are quite significant and they really, really are not happy with how things are looking. And obviously then that's a personal choice and a personal issue for the patients, and I'm happy to perform the surgery. But we always warn our patients that if you're having the surgery now, but have plans to have another child, that's likely to impact the results of the surgery that will be performed. So for example, if a breast uplift has been performed and you get pregnant and want to breastfeed your child, then obviously there will be some changes and it's likely that the breast will become more droopy after the breastfeeding. The same thing with the abdomen. So if the abdominoplasty is performed and you have a particularly large child, then there will be excess skin and there will be separation of the muscles. So overall, I don't think it is unreasonable to have this operation once the family has been completed, but it doesn't mean that you can't have the surgery and get pregnant again. With every surgical procedure, there is a risk and patients have to be aware of that, and it's my job as the surgical practitioner to ensure that patients are well informed and they know what they're getting themselves into. As a general rule, all operations have some general risks that it also applies to a mummy makeover as well as other operations. These are general risks such as general anesthesia, DVT-PE, or having infections after the operation, and general lethargy. Specific to the mummy makeover, then we have to think of each individual steps of the operation and explain that to the patient. So in terms of the breast surgery, there's always a risk of changes to the nipple sensation. Nipple loss is a possibility if there's a big distance for the nipple areolar complex to be moved, to be lifted. There's always a chance of asymmetry, scars can break down, and the need for further surgery. If an implant is used, then obviously this has its own inherent problems such as implant rupture, capsular contracture, and the need to change the implants every 10 years. Now, if we think about the abdominoplasty side of things, it has problems with wound breakdown, seroma formation, which is a fluid that forms after the surgery, can hang around for about 6 to 8 weeks after the operation. And sometimes there are areas of wound breakdown, and we see this actually about 20 to 25% of our patients, and the need for further surgery and liposuction. So overall, I would say the complication risk of a mummy makeover is in the order of 20 to 25%, and of this 80 to 90% are actually wound healing related. The majority of these are managed in the practice and patients do very well.